Hello everybody. I'm Dr. Raghavendra Ramanjulu, Lead Consultant, Pain, Palliation and Rehabilitation Services, Aster Hospitals, JP Nagar. I frequently get a question, is hospice care and palliative care the same? Is hospice the same as the care which is given for everybody at palliation in a hospital like RV, Aster? I would say there is a lot of difference. Now, what are we talking about? The most salient features is hospice is a place wherein end-of-life care is taken to the best of its ability. Now, in our culture, in our context, putting a loved one into a hospice might not be that socially acceptable, and most of them would not like to abandon their loved one into a hospice center. Hospice and palliation would be the same in terms of the principles which are followed in hospice, that is, take care symptomatically and supportive care measures which are very, very good. Now, when it comes to hospice, when they're very terminal, you're talking only about symptom management. Pain, nausea, vomiting, constipation, delirium, breathlessness, cough, these are the things. And that's something which is possible from the start of the disease or the illness itself. In palliative care services at Aster Harvey, we believe something on the acute palliative care unit model, wherein the disease management per se is going on, and still you would like those supportive and symptom control going on with the trajectory of the disease itself. So that is what is palliative care. Hospice is a part of palliative care services rather than as a different entity. And in our country, when it comes to the social context which I just mentioned, it is more in terms of home care which is acceptable. So at Aster Harvey, we would suggest strongly to have home care services based upon a team management which we could suggest after going through the entire gamut of conditions and problems which they have, and individualize the treatment plan and the supportive care which might be required at home. It could be in terms of a caregiver, a nurse, when there are medications and injections which are given. At the same time, if the end is not very close and it has to be followed up in the hospital, we could do it at OPD. We could do it at IP services when there are blood transfusions and other things which are required in supportive care measures, not letting go the psychological aspects as well as spiritual as well as social aspects being lost during a treatment phase. So hospice is a part of palliative care. To actually have the principles applied both, it would be the same in hospice, but socially acceptable to our country norm would be more of home care services. So we at Aster are thinking about delivering that through Aster Extended Care at Home. So it would be the same principles which we follow at the hospital, which we delivered at home, based upon the interdisciplinary team management services. So please come over to Aster RV to have an interdisciplinary holistic care which is required in terms of any life-limiting illness. It could be at hospital or at home, where we can extend the services from Aster RV home back. It's called as Aster Extended Care Services. Thank you all.